Hi, I'm Marion. I never really vlog. This is the first time I'm ever doing it. And the reason I'm doing so is because I'm going to undergo operation, and my cousin who needed operation a while back, she told me that she was really much more calmed down by watching YouTube videos about what was going to happen to her. And there are not many videos out there explaining the surgery I'm going to have, so that's why I decided, okay, maybe I should vlog, and maybe hopefully I can help someone either who is willing to undergo this operation, or maybe someone out of your family that can then help you, maybe help someone else try to explain them what other options there are. This is the part where I explain you how I prepared for the operation, which I'm going to have in 2 days in Belgium. I'm now in Holland, so I still have to drive there tomorrow, but that will be all right. So the biggest risk explained is probably that I could get an infection. So a lot of the preparation work has to do with not getting infections. That's the main thing, and that's also the easiest thing. I think as a patient we can work on ourselves to speed up the recovery, besides of course trying to be in a good health and eat well and all that, but that's like for every operation. So what was the first thing I had to do is, after the last meeting with the doctor, I had some papers with me that they had to draw some blood, run some tests, and they had to check on the hospital bacteria, which they call MRSA in Belgium and Holland. Not sure it's the same name around the world, but that's what they checked me on. And those results I have to take with me when I go to the hospital tomorrow. So the second thing is that I got a recipe for disinfectant. We call it betadine. And Bactroban, which is a cream for in my nose. Both are disinfectants, and the betadine I was supposed to, and I did, wash myself with it for 5 days prior to the operation. So each day I had to wash myself with it on the part of my body where they will make the incisions. Then I also got the Bactroban, which is a cream I had to put up my nose twice a day, also for 5 days in a row. So because I was going to have to wash my lower head, which is where they're going to make the incision, with the betadine, I decided already 6 days beforehand to get my hair shaved off. I used to have long hair until about here. Now it's really short for me. But otherwise it just looked really silly after the rest was all shaven off. So I went to the hairdresser to get this done. I didn't have to do this. They didn't tell me I had to do this to prepare. However, they did understand that as a lady we might want to try and get our hair back to nice and normal as soon after as possible from the operation. So they were very much telling me, like, from where on I'd probably have to shave it off so that it was good enough for the doctor to make the incision. So I went to the hairdresser. They shaved it all off 6 days ago, and then this morning, which is 2 days before the operation, they actually reshaved about 4 centimeters and this long from my head, where they're really going to make the incision, because of course the hair started to grow back a little bit more already, and it has to be really clean shaven. Of course, if the doctor decides that more needs to be shaven off, then well, he'll probably just do it, but this was the best option. So that's what I did. I'll show you now what it looks like. I'll show you some pictures after as well, what it looked like before and after at the hairdresser. But for now, I'll just turn around and show you what it looks like. So as you can see, it's not that bad. Yes, it doesn't really look great, but like putting my hair over it, you can't see much, at least not from the front. From the back you can see it a little bit, but it's okay. And for the time being I just put a hat on. It's still winter outside, so that was fine. So then after that, I just washed it really well with the disinfectant, and I kept it on for a while in the shower, and then afterwards I just take it off. One of the tips the hairdresser gave me was to actually put my other hair up, wash it before, and then put the conditioner in. Put it all up like this, put a towel around it, and then start washing the rest, because she said otherwise the rest of your hair might get really orange. So I was really happy with that tip. So that pretty much worked well. It's not orange anything, it's blonde, which is the way I am, so that's great. Then I put the stuff in my nose. It feels really strange to do that, but yeah, that's also okay. You get used to it. Just you can't forget it. So it's like really when you brush your teeth in the morning and the evening, just put it in. And then one of the other things I had to do is take out jewelry. So I had piercings, I still have piercings in my ear. This is now bioplastic, and this one as well. They used to be metal, but I have to remove all metal before the operation. I did this a week before the operation because I couldn't take it out well myself. And if they take it out, like, it was kind of irritated and it started bleeding a bit. So they put the bioplastic in so that the holes stay open during the time that I have the trial period. You don't have to, of course. I mean, if you've got piercings and they don't close, then just take it out and that's good. But mine, they close rather fast, and the bioplastic I was allowed to keep even during the operation. So the bioplastic is in. Said they'll just put some plasters around it during the operation, but that was fine. So that's what I did. The other earrings, necklaces, jewelry, all that I just will keep at home. I won't even take it with me to the hospital, but that I can take out tomorrow morning. So that was the most important. Rest of the preparations I did is really properly wash my bed, disinfect my car, disinfect the house. Well, not the full house, but like really properly vacuum it, you know, like take away the dust, and then with some disinfectant wipes I went over the tables, all that, door handles, that kind of stuff. And then I've got disinfectant soap at my home now, so that if people visit me later on, I'll just ask them to wash their hands before. So that's all you can do to prepare. I still have to pack my bag, and that's about it. This is about my expectation, but then later you'll directly see what actually happened. So what I'm expecting is tomorrow to drive off to Belgium tomorrow morning. I'm staying 1 day prior to the operation in the hospital. I'm assuming they're going to get everything ready for the anesthetics and all that. I'm not allowed to eat anymore, I think from the evening onwards, and not drink 2 hours before. So that's it. Then in the morning on Friday, I will be operated on, and then if everything goes well, the day after I can go home. So it's 3 days in the hospital. I'm then expected to go home, be very careful not to get infections, really properly take care of the wounds, especially the open wound. As I explained in the previous video, in Belgium we go through a trial period, meaning that the battery is staying on the outside for 1 month. In that month, I will try whether the system works well enough for me, and if it does, they'll put it inside me and just close it all up again. So for 1 month, I'm going to have a belt, they said, around the battery, and I'm going to have to be super careful not to get infections, which is probably meaning, they told me, that I can work from home behind my computer, but I'm not really supposed to go a lot outside. I can, of course, a little bit, but I have to be careful, and definitely not into stables, which, as I'm a horse girl, that's something that it's good they told me. So I'm not allowed to go into the stables, and of course be careful with animals and anything dirty anyway. So for me, that means that I kind of blocked out my agenda for at least 1.5 weeks for a normal recovery, and then afterwards I'm hoping I can go back to work behind my computer at my home. So that's what I'm expecting. plan to do a vlog now. It was actually supposed to happen. I scheduled it in another week, which would have been exactly a month then after my first operation with the trial for the stimulation. However, due to the virus right now, the doctor had called me and they want to do an operation directly tomorrow morning because they're too afraid with the open wound and the coronavirus going around. So they're gonna do the implantation tomorrow and close me up and hopefully get me home safe and stay in the house and stay safe. So between the actual operation and now, so the first operation and now, we've made a lot of pictures. And I will explain you in the vlog later on what actually happened, but it was a lot more tough than I thought. I thought I would walk out of the hospital, but that wasn't the case, and I also thought that after 1 week on the couch I would feel a lot better, but that wasn't the case either. It was a week in bed, and then afterwards it was more like couch, back to bed, couch, back to bed. Anyway, so this all came very sudden. I was called to it this morning and we had to drive from Holland to Belgium. So we packed our stuff and we got in the car and now I'm here. So I'm about to go to sleep, and then tomorrow morning we'll have the operation, and I'll try to see if I can vlog as soon after. At least we'll make sure we'll make some pictures. However, there aren't any visitors allowed. So last time my mom made a picture directly after the operation because she was able to visit me and make pictures so that everyone could see what it would look like directly after the operation, but it might be like 1 or 2 days after now, as they're not allowed to come by. So she's only allowed to pick me up to go home, drive me home back to Holland. So I hope that this is just like in between. I wasn't planning on doing this vlog, but we'll put it in between the whole video so that yeah, people can see this as well. So for now I didn't really prepare anything. I just had to take a shower just now with the betadine, but as I still have an open wound and I have the battery on the outside, I'm not really fully able to take a shower. So I partly took a shower, washed my hair and legs, and then like my back, half of it. It's not really possible. Same for my belly, so you can just do half of it and have to be super careful that the water doesn't get in. Anyway, they told me I have to do another shower this tomorrow morning before the operation, and after that I'll probably be sleeping again. So yeah, this time won't be thinking I'm walking out of the hospital all happy and all that, but I'm a bit more prepared for the things that are coming. When you're having cluster, you kind of think that you have had the worst pain that is possible. So cluster is still worse than the pain from the operation. It's just a completely different pain. So I think it's more the fact that you're not used to a completely different part of your body that is in pain, was more probably hard and difficult to cope with than actually the pain itself. So and of course the first operation they did a lot in my neck to get the ropes, the electrodes into my neck, and I suffered quite a bit from that. That was really painful. I couldn't move it much, and it was just like someone completely hit me with bats in my neck. The same for my back, and the doctor called it like it's probably like a tram or a bus drove over you, which was kind of that feeling probably, but this time it's just going to be the lower back that's going to feel like that. So that's already a relief that it's not the neck. So I'm not doing a few trials on this video. This one I'm just doing it now and going to sleep. So I hope for everyone that this is still interesting, and yeah, normally I would have done a elaborate video in between, preparing myself for the second operation and explaining everyone what I had to do, but that's not really possible now. So just a quick one in between, and I'll update everyone later on, and I'll get back to you with like the exact things what happened and how I felt and all that. So okay, bye bye.
Say what you wanna say to me now.
So this is the first time I'm going to be charging myself. So I'll explain you here what is going on. It will be the first time, so I also don't know what's going to happen when we open it up to plug it in, but we'll see. So you have this short manual, that's what I got, but I also had a really big thick manual that I read through already, so this will do probably fine just to get me through the steps now. I read through what is like important, and the first 10 days I wasn't allowed to charge because of the wound that I had to recover, because apparently it can get a bit warm when you charge it yourself, but I don't know because it will be the first time. But anyway, tomorrow will be 2 weeks, so we'll be fine. So what I did already yesterday is this. I charged this device because this is normally the device that you use to turn it off or on or higher or lower. However, it's also the charger for your battery inside. So what I did yesterday is I plugged this into the system, and then I plug this into the electricity, and when it turns green it means that it's fully charged. I'll show you. This is the device itself. So you press on this button and then it opens up, and you go to unlock. You hold this and then it will search for a device, which means now it's searching for my battery inside me. And here is usually the parts where you decide if you want the intensity higher or lower, left and right. I've got two sides. And this is the battery. So this battery is 100% charged. That's what I did yesterday. And this battery is low, as you can see. It's still orange, so that means I've got time now to charge. But if it's red, it means you have to do it very fast. So I decided that now is the time because it's gonna be the first time. And also it tells you in the manual that when it's like this you need to charge, so let's do that. So I'm gonna put it down for a minute because it tells you that this will go over the battery where the battery is implanted. You can either wear a thin layer of clothing, and you will have this belt that you can use. So you tug it into here. Apparently never done it before, so let's see how that goes. It's a bit tough, but we got it in. So apparently you put it in here, so it has the hole there, and this will be between your skin and the battery as well. So you can either have some clothing in between, or just this. For me now I still have a plaster over it, so yeah, there will be enough in between. I don't know if it will go well, but we'll see. So then this is the belt that you use. So you put around it, put it around you, and the cables and the device can go into the pocket here. I'll film it when I put it on later. So that's where it goes in. And yeah, that's apparently the way that it goes. This is usually the pocket where I leave it in, so it's protected. So what I'll do is I'll start putting it in and then see what happens. So I'll turn it back off. So turning it on to unlock. We unlock it and we plug it in. Oh, and now it already tells you to put it. It tells you now to put it on the place where your implant is. So I'll be doing that now in the bathroom. I'll video or film again there for you to see, because then I can look in the mirror at the same time, know what I'm doing. So yeah, let's go ahead and do that. So it's a bit weird, don't know how to do this in the mirror, but I'm trying it like this because I need to see what I'm doing, and you as well. So there's the device again. We're plugging it in. And it tells me to put it in the right place. So I'll put it into the back here. Or no, wait, I'll hold it first. Okay, so you see the first time isn't that easy. You need to find a way to put it on. So put on the belt while holding the device. So I already made it into my size. So the belt is on, and now I have to position. You see, there is the battery. So now I have to position it. I think it's right over here. And as you can see, this is, and I'll put it to the side. It says it's looking for a device now. Let's see what happens. I don't know. It's there. Oh, cool. And it's telling me now. I don't know if you can see it. It's telling me it's good, and that, oh, now it apparently I moved, and yes, it's good again. So it's charging now. So as you could hear, it makes, now it has a green light, meaning apparently it's charging well. In the manual it said when this is like fully green, it means it's fully charged. And yeah, what you heard is that it makes a sound when it's not on the right spot. Can't say I feel anything. It's not hot or anything yet. Nope, don't feel anything. So what I'll do now is I'll stop the video and go down, sit on a couch, and yeah, I'll let you know afterwards how it went, I think, and how long it took. I'll check that as well. So it was like almost empty now, so I'll check how long it took for me to recharge it and if I felt anything. So now I don't have the clothes in between, just the band-aid and the belt. If it changes, I'll tell you afterwards if I put it down or something like that. Okay, see you later. So here we are, it's 1 hour and 10 minutes later, and it's fully loaded. So this one went down to 40% and my battery inside is 100. So that's really great. I think I can stop now and I'll charge this one again so that this one is 100 as well. And I'll probably be good to go for another 2 weeks. I'll make another vlog or video when it's time for the next time to charge it. Alright, bye bye. By the way, it didn't hurt at all and it wasn't warm. It's been 2 weeks since the last charge, and in the meantime, a week ago I started with some yoga exercises and fitness exercises, really light, very carefully, and I started walking as well. So every day I walk a little bit, and I'm trying to extend that. I was, after 7 days, I was on 4 kilometers, so that's good, but I'm taking it slow, so if it doesn't feel good one day, I'll just walk less. Also, the wounds look really good. The scars are healing really well. So the scars from the first operation, 2 of them already turned into my own skin color, and the one in my neck, it's still a little bit red, but you can't really see it. I'll show it in a minute on a picture, but the hair is there already, so that's cool. I've got a bit more hair, I'm not fully bald. And the other 2 scars from that they've reopened, and the one that is new where the battery's in, it's still a little bit red, but they look quite good. They're healing really well. You still see a few stitches because these were stitches that they didn't have to take out, so they have to just disappear themselves. And yeah, they're very fine. So with the exercises, I'm careful, because then you like, as soon as I feel a little bit of tension on one of the spots, I stop. So I'll show the pictures here. I'll show them up in the video so that you can see what the scars look like now after almost a month after the operation. And here you can see that I've already got hair again. I just tend to put it up like this, sometimes a bit lower, so that you block it, that they can't really see it. And here's from the other side, like you can't really see the scar anymore. Here it is, still a bit pinkish, but the hair goes over it, so that's fine. Okay, it looks a bit strange from behind, but no one sees it anyway, not really. it's time to charge a second time. It's been 2 weeks and 1 day since the first charge, and it told me that I need to charge again. So I'll show you what it says now, and I'll just be doing exactly what I showed in the other video, putting it around me and putting the belt around me and turning it on, but that you've seen already. I'll show you what it says. You turn it on there, and here it says unlock. To hold it, looking for my device, and now it found it, and here it says it's low, so I need to charge again. This one is still at 90%. I only charged it after the first charge again to 100%, so in 2 weeks it only reduced by 10%, so that's really good. It will reduce once I've fully charged this, so then I have to recharge the device itself. So I'll be doing that in a minute, and this is where it is in. So I left it in here. I left everything in here, so the only thing I have to do is plug this into the device, turn it on, and then attach it to my body. So the past 2 weeks, I have the feeling I've had less attacks. There were days that I had attacks daily, so there were like 3 days that I had an attack every day, and that really made me scared that it would happen again, like every day or more often. I couldn't get them down with the device. I tried putting it higher, the electricity, but that didn't work. So I had to take injections, and that kind of sucks when you have to do that. But after that, I had a few days without any attacks at all, so that felt really good. No pain, not even like shadow pain or anything, so I was super happy. And then I've had some days that I felt I was getting an attack, but I turned it higher, and it worked. So I just turned it higher. You feel a bit more like the electricity going all the time then, but it went away, and I was actually able to sleep. So like I turned it higher before going to sleep because I was starting to get an attack again. And then I don't know, I woke up without anything, and I didn't feel pain, and I was quite good. So then you do have to turn it lower, because at least for me, because then it kind of hurts, or it feels like it hurts a bit where the electrodes are. So I turned it from 1.2 to 1.6, 1.7. And then after going through that for a whole night while sleeping, it just didn't feel good anymore in the morning, but the headaches didn't come, so that's really great. So it's definitely worth it, and it's like such minor pain compared to what you normally have that it's okay. So that was it. So I'm really curious what's gonna happen the coming 2 weeks, because right now I'll be charging it again. I have the belt with me. I already put my shirt up. So my shirt is up, and nope, there's no six-pack. And here is the battery. So let's see. I'll first put it on. And as I still have the patch over it, the band-aid, I won't put my clothing over it, but I think I will put clothing over it like the next time, if it would be off by that time. I don't know if it will be in 2 weeks. I still keep it on because you can still see some stitches, and I don't want my clothing to get stuck in them, which hurts. So yeah, I just put them on, and every 2-3 days we change them. And I can shower with it because it's waterproof, so that's quite nice. And then every 2-3 days I just shower when it's off, and it's allowed to get wet now, so that's fine. So I'll turn it on. Unlock it. It says it's looking for a device, and I'll plug in the charger with the arrow up, facing upwards, and it says position. It says to position the battery, the charger. So that's what I did, and then I press continue. Let's see what happens now. Still looking for a device, it says. You can see still looking for a device. this sometimes takes a while, like charging, but also when you turn it on. And I'm seeing a green light, which means it's charging, and it says uitstekend with me, which means in Dutch that it's perfect. So it's placed perfectly, and yeah, I did feel like some stingy thing just now, but it doesn't really hurt. Let's see if you guys can see what happens when I put it in a wrong position. See? So it makes a noise and tells you that it's not put in the right place. Then you place it back and it tells you it's charging again. So like I walked around with it, which didn't really work last time. So what I did is I grabbed myself a tea, and then I just sat on the couch and I watched for an hour. I watched some TV and then it was done. But as soon as you move around and it's not on the right spot, it will just make that sound. So it alarms you that it's not charging properly. So by now, I'll just put it in here, in my pouch, my fanny pack, and close it, and I'm ready to go. So it takes about, last time it took about an hour. I'll check again how long it takes now to charge it, and I'll tell you afterwards. Bye. So it's been exactly 1 hour, and it's fully loaded. So you can see that this one reduced to 50 and this one is 100. So I'll say stop now, close it, and I'm taking it off, and then I'll recharge the device. So to recharge the device, I'll just have to plug this in with the arrow up. So I'll do that, get it charged back to 100. It was a little bit stingy sometimes, the feeling when you're charging, but it didn't hurt nor did it get really warm, so that's great then. Hi everyone, so this is my last vlog for now. I might do another one in 6 months or a year to give you another update, but for now I think I should post this online to start maybe helping people who are thinking of getting a similar operation than I have, or who have already scheduled one but would like to know a little bit more how things go. So I'm going to be looking back on if things went differently than expected, what I felt after the operation, how I feel now, and about the attacks, of course, that I'm having now. So looking back, what went differently is I talked about a belt that I was going to wear after the first operation around the trial battery or the trial system, but I did not get a belt. It was just they sticked the battery to my belly with a plaster, so that was a little bit different, but it was fine. And then actually patients after me already, I know, only had one operation where they directly got the battery implanted, so they didn't have to go through 2 operations. And then another thing that went differently is, of course, because of the corona, my second operation was not really scheduled. It was just they called me, I had to go. I couldn't really prepare. Then of course in the hospital things were different. The second time having to wear masks, and yeah, everyone very careful, not having visitors. We were in quarantine before the second operation, we were in quarantine after. So yeah, things were different. Similar for nurses, we had usually scheduled to have the nurses come and help take care of the wounds, but yeah, they couldn't come anymore, so they explained my mom how to do it. But in the end, everything was fine, and yeah, it was pretty okay. The other thing is that with the feeling of right after the operation, I think I did not really get it in my head what it would be like. So I thought that, as you probably heard in the previous videos, that I would be working fast after, I would be sitting on the couch and all that, but that really did not happen. So you really schedule at least 2 months. If you have 2 operations. If you have one, maybe 1 month is enough, but if you have 2, schedule 2 months out of your agenda. Whatever you can do is great. Whatever you can't, it's no problem. So that's something I had to change a little bit in my mind. Plus also, I really think what you should do is, as soon as you start to feel a bit better and you're allowed to move a bit more, is take up some exercises, try to get your health back and all that. So I really did that. I started with yoga, which I never did. I think it really helped because of the ropes that are in your body. I think the yoga helped me relax a bit more and start moving a bit more naturally again after, because at the beginning I was moving around very stiff and scared to move and all that. So that helped, and then I started doing some fitness again, slow exercises, not with weights, all that, just really easy stuff, but just to get your body moving. And after that, when I was allowed, I started running again, which I didn't do for almost 2 years, I think, or even longer. So I was super happy to start with that again. You have to really start on the soft ground, because the bumps you will feel it a bit on the battery spot. But if you really, I did it really easily. I slowly increased it. I slowly also increased the underground. And now I'm able to run on the hard underground without really pain. Sometimes I might feel a little bit of a sting at the battery spot, like the day after or just like 1 hour after, but usually there's not really any pain anymore. Just if you make some really strange movement, you might feel like, ooh, okay, that maybe wasn't the smartest thing to do. Just take it calm then, and if it disappears, I think it's fine. If it disappears fast enough. So that happened until now with me, so that's okay. I still don't like people touching my head. I think that's because sometimes I do touch my head behind, and I would touch, I think, an electrode or something, and I just don't really like that feeling. I don't care, people sometimes touch the battery to feel like what it feels like, that's fine. I don't care about that. Yeah, it's just my head, I don't really like, yeah, if they touch. The incisions, they look really good. So the scar tissue, I think, looks really nice. I'm very happy with it, the way they did it at the hospital. So the way the doctors sewed me back up. So I'm really happy with that. And I've been very careful with that too. So not putting any stretch on the skin there. So yeah, I think that was a good thing, good call to do that. And then right now, it's been 4 months since my last operation. I feel so much better. So everyday life is a lot easier. It doesn't take as much energy. It doesn't take as much strength. Everything goes more naturally without thinking, without feeling heavy and like an 80-year-old, because I felt like an 80-year-old for a long time. And everyday life things were just sometimes really tough. And right now they're just feeling a lot more natural, and you don't really think about it anymore. Walking the stairs is the best example. I used to dread walking the stairs up because my legs halfway would just be dead. And now it's fine. You know, I can walk up the stairs, I don't even think about it. I can even run up the stairs. So that's really great. Also, I have a lot more energy. So that's a big thing too. My bowel started to calm down a lot. I'm not retaining as much water. I really retained a lot of water, which is now a lot better. Not fully gone, but so much better. And I'm running again, jogging, like I said. So yeah, that's really great as well. So those are the biggest things that changed, is your everyday life. And then for attacks, I still have attacks, so it's not gone, but it's so much better. So usually I used to take a minimum of 24 injections a month, and that was like on an average basis. And then a lot of the time it would go up because I would have 2 days that would be 15 injections, a lot of attacks, and that would happen quite often as well. So yeah, it was really bad actually looking back, and now I feel really a lot better. The only attacks I'm having right now is when there's a thunderstorm. Those are bad attacks. They do happen to have then like 15 attacks in 2 days around the thunderstorm. I can't seem to stop this yet with the device, so yeah, that's something I don't know yet. Maybe in the future I'll be able to handle them, but for now I can't handle them with the device. I handle them with the injections. And what I do after like 2 days of those really bad attacks, I also take at least 2 days to recover again, which before I wouldn't do it. Like most cluster patients also probably understand, is you have no time for recovery because your next attack will come and you need to do stuff. So you need to get groceries, you need to whatever work, you need to do the laundry. So before you would never have time to recover, and now you just have a bit more free time. Actually a lot more free time without all the attacks. So yeah, I take time to recover now more than I used to do. Plus right now my maximum without attacks is 5 weeks, which is really long for me. It used to be 2 weeks maximum, and average is about 2 weeks now that I don't have attacks. And then if there's a thunderstorm coming after 2 weeks, it just really, yeah, it just kind of messes everything up. But in between it's really good. So like the everyday attacks that I used to have, or the every other day attacks, they're not there anymore, and that just really helps a lot. So I'm very, very happy with that. So how I handle it now is that my device is always on. I found a setting that works for me. I think that's something that's very different to everyone. I talked to another lady that had the operation after me, and she can go up way higher than I can with the electricity. So like if I would go as high as she goes like 2 something, I can't handle it. It just hurts. Everything starts to go like this. I think I'm making myself get an attack by doing that. So I think this is something that you really have to figure out personally, like what works for you. I have it differently, so I've got left and right, and my right is much higher than my left. I've got it on 1.6, 1.7 every day now, and this one is on 0.6, 0.7. Sometimes when I'm starting to feel like, you know, you start to get the pain a bit here or in your eye, or you start, you know, to get your droopy nose or whatever, then I would put it up a bit. But for me, I can't put it up too high because it just doesn't help. So if I put it up a little bit, and if I'm really in time, I'm able to prevent the attacks from happening. But usually it's enough just to have it on the stable everyday electricity, and I just won't get the attacks that I used to get. Just like I said, it's with the thunderstorms, I can put it up as high as I want. I can put it up to 2, 2.5, whatever. I tried it, but it just doesn't do anything. It makes it worse. So yeah, then I just forget about it and I take the injection. So that's how I do it now. For me also, I have to charge about every 2 weeks, so it's really not a big hassle at all. And the charging takes about 1 hour, 1 hour 10 minutes. I can't walk around with it because it just moves and it doesn't charge properly, and it's annoying. So usually I get my breakfast, sit behind the laptop, start working and put it on, you know, have a tea ready there so that you don't really have to move, and then after an hour it's done. So it's really good. You just need to remind yourself to check it once in a while to see if the battery's still going okay. And you can't forget the device, like you can't go anywhere without it. So at least I wouldn't do it, because it feels strange not to be able to control it. So I take the device everywhere. What was annoying is going on walks, because you don't want to take a bag, and you know, you have a little clip-on thing to put on your pants, but if you're having a dress, it doesn't work as ladies then. So maybe for men it's a little bit different, because they usually wear pants and they don't really care what it looks like. I care a little bit what it looks like, not a whole lot, because I mean, in the end it helps me, so whatever, screw the rest who doesn't like what it looks like. But I do want to try and look a little bit fashionable and not think about it all the time. So I bought myself a little pouch with like a little bag on it. It's fashionable, whatever, it fits in, that works. So if I go walking, I'll put that one on. If I just go somewhere else, I put it in my purse. And if I go jogging, I bought this thing which goes around my back like this, and with a strap down the back as well, so it's really stable and it can fit in there, and I feel comfortable that I'm having it with me. So yeah, that's about it. If you have any questions, remarks, whatever, you would like to get to know me more, get to know the situation more, or get in contact, yeah, just send me a message. I'm very open to answer questions or concerns or anything. And I think I will indeed upload a video again in 6 months or a year to tell you a little bit how I went through the year, because I think as cluster patients, things might work for 1 or 2 months or a little bit longer, and then they stop working again. So I'm very curious also how this goes for the coming half year and a year and further on. So I really hope that you enjoyed watching the video. I hope it answered a lot of your questions. Yeah, as you can see, I mean, I've posted up some pictures that are pretty personal, but I'm happy to share it with you if it can help you as well. So for now, bye. If you're having the operation, then I wish you a lot of luck. And if you have more questions, get in contact. Bye.